Hello Bio242. In this video we're going to introduce the lymphatic system and talk about how the lymphatic system circulates fluid from the tissues back to the blood. This is the first video on the lymphatic system. In the second video we'll talk about the lymphoid organs. Together these videos cover approximately pages 765 to 769 in your textbook. We'll skip over the discussion of the lymphocytes for now and pick the lymphatic system back up in pages 772 to 776. Before getting into lymphatic drainage, I want to take a moment to talk about the functions of the lymphatic system. The functions of the lymphatic system can be divided into two categories. First, it acts as a second circulatory system. The lymphatic system picks up interstitial fluid from the tissues of the body and drains it back into the blood. The lymphatic structures that participate in this function are the lymphatic vessels and the lymph nodes. The lymphoid organs serve as the anatomy of the immune system. The immune system is a functional system. It consists of immune cells that protect your body from infection. Immune cells gather in the lymph nodes, the spleen, and the lymphoid nodules. These are the structures where the immune response to infection gets started. The lymphoid nodules include the Peyer's patches of the small intestine, the tonsils that surround your pharynx, your throat, and the appendix off your large intestine. The thymus is a lymphoid organ too, but its function is different from the others. The thymus is where T lymphocytes go to mature after they leave the bone marrow. You saw this image before when we were discussing the cardiovascular system. It shows the relationship of the lymphatic system in green to the cardiovascular system. Remember that fluid leaks out of the vascular capillaries into surrounding tissues. More fluid actually leaks out than can return into the vascular capillaries. This excess tissue fluid drains into the lymphatic capillaries. Once the tissue fluid has entered the lymphatics, it's called lymph. Adults generate about 3 liters of lymph every day. The lymph contains cells and proteins as well as water and small solutes. It passes through lymph nodes and is returned to the blood near the heart. This lymphatic drainage is critical to normal functioning of the body. If lymphatic drainage gets blocked, fluid will accumulate in the tissues, causing swelling and discomfort and possibly limiting mobility. Lymphedema is the term for this accumulation of fluid due to blocked lymphatics. Lymphedema is more common in obese individuals, and you also tend to see it in cancer patients after treatment. You see, when cancer begins to spread through the body, a process called metastasis, cancer cells get swept into the lymphatics along with tissue fluid. So, if a cancer has metastasized, you'll find cancer cells in the lymph nodes that drain the tissue around the tumor. Often, the draining lymph nodes will be removed as part of the treatment for cancer. This is done to get rid of any cancer cells that may have spread to the lymph node. However, removal of the lymph nodes impairs lymphatic drainage. One severe form of lymphedema is called elephantiasis. Elephantiasis is also known as lymphatic filariasis. It's caused by a parasitic worm found in tropical regions. These worms get trapped in the lymphatic system, blocking drainage. The immune response to these worms can cause scarring, further blocking drainage. You get massive fluid accumulation and inflammation that can lead to thickening and hardening of the skin. This diagram shows the distribution of the lymphatics in the body. Note that lymphatic vessels are found throughout the body, in the head and neck, the arms, the legs, the chest, and in the abdomen. Lymph nodes are found throughout the body as well, but they are particularly concentrated in the inguinal region, the groin, the axillary region, the armpit, and the cervical region, the neck. Lymph nodes trap the lymph, slowing it down, enabling immune cells in the lymph node to sample the fluid for infectious organisms. When bacteria or viruses are present, the immune cells in the lymph node initiate an immune response. If you've ever had a cold or sore throat and felt swelling in your neck, it's your cervical lymph nodes. They swell with immune cells, proliferating to fight off infection. These images show you what the lymph nodes look like in a cadaver. They are small, pearlescent lumps that blend in with the surrounding connective tissue. I want to talk now about the lymphatic vessels. We'll go over the structure of the lymph nodes in the second video when we talk about the other lymphoid organs as well. The smallest lymphatic vessels are the lymphatic capillaries. Lymphatic capillaries are found throughout the connective tissue of the body. There are specialized lymphatic capillaries in the wall of the digestive tract called lacteals. Lacteals take up fats from the intestines that are too large to be absorbed into the vascular capillaries. The fatty lymph that flows through the lacteals is called chyle, C-H-Y-L-E. Tissue fluid drains directly into the lymphatic capillaries, including the lacteals, passes into the larger collecting vessels, then into the still larger lymphatic trunks. The lymphatic trunks drain into one of two lymphatic ducts, the right lymphatic duct or the thoracic duct. These two ducts then return the lymph to the blood. The lymphatic capillaries differ in structure from the capillaries of the cardiovascular system. First, they are a bit wider so they can take in cells and large proteins as well as fluid. Lymphatic capillaries are also different in that they are blind-ended tubes. This basically means that the capillaries come to a dead end. Compare this to the vascular capillary beds. Remember that in vascular capillaries, blood flows into the capillary bed from an arteriole and out of the capillary bed into a venule. For the lymphatic capillaries, they just terminate in the tissues. The end of the lymphatic capillaries is particularly well suited to their function. The end of each lymphatic capillary consists of loosely overlapping endothelial cells that form miniature one-way valves, called mini-valves. These mini-valves open when the interstitial fluid pressure goes up, allowing fluid and cells to drain into the lymphatic capillary. If interstitial fluid pressure drops, the mini-valves fall closed again and keep the lymph inside the lymphatic capillary. The lymphatic endothelial cells are anchored to the surrounding tissue by collagen filaments. These collagen filaments hold the walls of the capillary apart so that it doesn't collapse when interstitial fluid pressure rises. Instead, you just get opening of the mini-valves, making the lymphatic capillaries extremely permeable. When you have infection or some kind of injury, you get inflammation at the site of damage. One effect of this inflammatory response is an increase in the amount of interstitial fluid at the site of inflammation. With a greater volume of interstitial fluid, the interstitial fluid pressure goes up, and the lymphatic mini-valves open. This allows inflammatory cells, cell debris, and any bacteria or viruses to flow into the lymphatic system and drain straight to the lymph nodes. And in those lymph nodes, you have immune cells waiting, ready to attack any harmful organisms that come their way. Lymphatic capillaries drain into larger collecting vessels. Collecting vessels travel alongside arteries and veins. The collecting vessels are similar to the veins in structure, but they have even thinner walls, more internal valves to prevent backflow, and they are very highly networked. The collecting vessels are very low pressure and receive no push from the heart to circulate the lymph. Instead, lymph is pushed through the vessels by skeletal muscles and respiration. When skeletal muscles contract, they squeeze the lymphatic vessels running through the muscle. This squeezing pushes lymph along. The lymph moves in only one direction because the valves prevent backflow. When you breathe, the pressure in your thoracic cavity decreases and the pressure in your abdominal cavity increases. This combination helps lymph move up towards the thoracic cavity, the area of lower pressure. The lymphatic trunks in the thoracic duct are surrounded by smooth muscle that also helps push lymph along. The lymphatic collecting vessels join together to form the lymphatic trunks. You have right and left lumbar trunks, right and left bronchomediastinal trunks, right and left subclavian trunks, and right and left jugular trunks. The jugular, subclavian, and bronchomediastinal trunks on the right side of the body join together to form the right lymphatic duct. You also have a single intestinal trunk that collects chyle, fatty lymph, from the intestinal tract. The lumbar trunks and the intestinal trunk join together to form the cisterna chyli. About 100 milliliters of lymph per hour pass through this enlarged lymphatic sac. The cisterna chyli marks the beginning of the thoracic duct. You can see the cisterna chyli and the thoracic duct in these images. The lymphatic ducts return lymph to the blood, roughly at the junction between the internal jugular vein and the subclavian veins. Here it is on the right, with the right lymphatic duct emptying in, and here on the left, you have the thoracic duct entering back into the blood. Remember, the right lymphatic duct drains the upper right half of the body, including the right arm. The thoracic duct drains everything else. After reviewing this video and studying the lymphatic vessels, you should be able to answer these questions. If you'd like to read up more on lymphedema, check out this website run by the Mayo Clinic. If you'd like to find out more on elephantiasis caused by microscopic worms, check out the page on lymphatic filariasis at the Centers for Disease Control. I do not recommend that you Google elephantiasis, at least not an image search.